Hi, I'm Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about NDC numbers and lot numbers. Whether you are familiar with what an NDC number and a lot number is or not, that's okay because I'm going to give you a brief overview about it today and explain to you why they're important. I'm also going to do another video where I'm going to do a screen share on how to find NDC numbers to include on your claims and to be documenting in your inventory information for your medications and vaccines. So let's start from the beginning. What is an NDC number? An NDC number is a national drug code, and this is actually assigned by the FDA. And I honestly couldn't tell you what the different numbers mean. I'm sure they have some explanation or some kind of code behind them, if you will. But usually it's 10 digits, and it's going to be a certain amount of digits separated by a hyphen, then another certain amount of digits, and then another hyphen, and then 1 to 2 digits at the end. There are a total of 10. However, when you're billing on claims, NDC numbers are required anytime that you're billing a medication or a vaccine, and they actually require 11 digits on the code. I know it makes no sense why they would assign 10 digits when you actually need 11. However, there is a little rule behind it, and since there are 3 different areas where the code is, there, like I said, there's one section separated by a hyphen to another section separated by a hyphen for the last section. The 3 separate sections usually on the claims need 5 digits, then 4 digits, then 2 digits. So wherever you're short a digit, so if you only have 4 in the first one, you would add a leading 0 to make it 5 digits, the required amount. If you were short the 4 digits in the middle, then you would add a leading 0 in the beginning to make sure that it's fulfilling that 4-digit requirement. And if the last number only has 1 number, then you would add a leading 0 there to fulfill the 2-digit requirement. So on claims, it needs to be 5, 4, 2, but it can be different amounts of numbers when you actually get the packaging for the medication or the vaccine. NDC codes are based and can change because of the manufacturer, the dosage, things like that. So you're not going to have the same NDC number on all of your ketorolacs or on all of your promethazines, because depending on which manufacturer you get it from, what dose you get it from, it can change. Now, with vaccines, because there's only so many manufacturers of vaccines and standard doses of vaccines, those may always stay the same. You might always have the same NDC number for your Tdap if you're always ordering from the same manufacturer, or for your pneumonia vaccine, your Pneumovax 23. Those might always have the same NDC number, but usually medications will not because, again, formulations, manufacturers, etc. A lot of times if you buy them in a package or a bulk supply, the box will have a separate NDC number than the bottle. And you're probably going, well, how do I know which one I should enter? Usually it's the one on the bottle. However, sometimes they do want the one on the pack. That's why the video I'm going to be releasing soon, showing how to look up those NDC numbers on the FDA website, will come in very handy, because you can look them up yourself and figure out which one you need to add to your claims and keep track of. Now, all these NDC numbers also have lot numbers, and lot numbers are exactly like they are on food, where they're assigned by batches. So all the batches made together are assigned one lot number, and then a new batch would be assigned a different lot number, etc. So those are always going to be changing. It's very important to be sure that you are keeping the NDC numbers, the expiration dates, the lot numbers, the manufacturer documented somewhere in your inventory information. So if there was ever a recall, a question about a medication administered to a patient, you have that data and you can pull it up. This is a patient safety thing, as well as just putting yourself at less liability, best practice, and required for administering medications. There's multiple facets here why this is really important. However, a lot of people aren't aware that an NDC number and a lot number kind of go together, and you should be tracking and recording all this all in one place. So the NDC number, National Drug Code, is required to go out on claims. Lot numbers are not. However, you do still need to document that. Hopefully your EMR system helps you with this. And there is also another thing that you need to be aware of with NDC numbers, and that is the NDC units. Now, people get really confused between the NDC units and the HCPCS units, okay? The HCPCS units are the ones that get billed out. So if a medication in the description of the J code, it says that it's 15 milligrams per mil, or it's every 15 milligrams, then one HCPCS billing unit is every 15 milligrams. So if you gave a patient 30 milligrams, it would be 2 HCPCS units on the claim with that CPT code. If it was 45 units, it would be, or 45 milligrams, then it would be 3 units associated to that J code on the HCPCS billing units. The NDC units are different, and there's a lot that goes into this. I will put links in the description of the video of some places that you can go do your own research. And I want you to do your own research. Usually people who have some kind of medical background, so the doctors, PAs, nurse practitioners, nurses, usually understand this way better than administrative staff, just because of the pharmacology background that they had to take and they have and they utilize every day. So I will put a link on how to figure out the NDC billing units. Now, not all insurances care about the NDC billing units. However, you still have to include an NDC billing unit with the NDC number on claims. Yes, that's true. So even if insurances aren't looking at the NDC number, if they're not looking at the NDC billing unit, you still have to have it on the claim. So you still need to make sure that it's getting on your claims before submission so that you are not getting anything rejected or denied for it missing. Because there are some insurances out there that do require it, and then you could be in a world of hurt if it's missing. So again, the link to how to figure out the NDC units, I will put links in the video description. The HCPCS units are what the billing units are on your claim associated to your CPT code, and that's per the CPT description. And vaccines, immunizations are usually pretty straightforward because you're not usually changing the dose, right? I mean, they're pretty set in what needs to be done for age groups, things like that. And it's the same manufacturers, and you already will know what the standard NDC billing unit is. It can get really confusing. So if you're an administrator or a manager watching this and you start doing the research from the links and you're like, oh my gosh, this is way over my head, don't feel bad. Just go to your doctor, go to a nurse, sit down with them, explain to them what needs to be done, and they should be able to help you. That's usually how I get things done in the practices I work with. They bring in their medical staff and we sit through it and they do the calculations and figure it out because it's just easier that way. They're used to doing it all the time, and that's kind of in their wheelhouse. So don't feel bad. It's always good to reach out to people in anything that have a little bit of a being a subject matter expert to bring them in to help with something like that. So again, make sure that you're documenting NDC numbers and lot numbers, making sure that when you're administering to patients that you're knowing which lot number and NDC you administered to them. Hopefully, again, your EMR system does that for you after you load the data. But if you are like, I don't know if we've loaded that information into our system, I don't know if we're doing this correctly, reach out to your EMR system, reach out to your administrator, say, hey, look, I was just brought to my attention that we should have this information on claims. Are our claims going out with the NDC number? Are we tracking the NDC and lot numbers somewhere in our system? And are we tracking which NDC and lot numbers patients are receiving when we administer vaccines or medications? Because those are really important. They're safety information, liability information. So if you're not familiar, it's always okay to ask and double check. If you have any questions or comments about that, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and always please share this with your colleagues whom you feel would benefit. Take care of yourself, and we will see you next time. Bye-bye.